Welcome everyone. I'm Dr. Salman, consultant plastic surgeon, and today we embark on a journey which is very interesting and which relates to nearly everyone. It's about hair loss. Everything about hair loss, from the reasons, the causes, the genetics, the hormonal, the environmental, to the treatment strategies, to the way how to prevent it, everything will be covered in today's video. Understanding hair loss, it is crucial in order to do some treatment for it. You need to know that hair loss can be genetic, androgenetic in male pattern or female pattern baldness or hair loss. This is the commonest cause. Apart from that, you have environmental factors, people moving in from one locality to another, from hard water to soft water, from a location where they have been living in plains to coastals, and from environmental changes where they have been living in a temperature of moderate degrees and now they have moved to extremes, whether that is heat or whether that is cold. All these things play an important role. You also need to understand that there are certain hormonal changes that also affect your hair. Apart from that, stress is a major contributor to hair loss. Certain diseases or illnesses or any viral illnesses that can also lead to hair loss. Now that we know the science behind hair loss control, we can talk about it in detail. So first of all, we talk about the types of hair loss. The commonest is genetic. In males, it goes to your father, it goes to your maternal uncles, but if you have anyone in the family with hair loss or baldness, it's a great chance that you're also going to go through this. The second one is hormonal, commonly affects females. There are certain nutrients and micronutrients that also affects hair loss. It could be iron, folic acid deficiency, it could be anemia, it could be vitamin D deficiency, it could also be deficiency of micronutrients. Apart from this, illnesses, stress, and different diseases, they all contribute to hair loss. Prevention strategies. First of all, healthy lifestyle habits. This is the foremost point. Nowadays, we do not take care of our lifestyle, and that affects our skin and our hair. Diet is the main precursor behind unhealthy lifestyle. You need to have fresh fruits, vegetables, and healthy homemade food in order to have a good hair. Vitamins, minerals, supplementation, they're key in order to get good hair. One strategy that a lot of people employ is if you can add one juice daily, any seasonal fresh fruit, that can also lead to control of your hair loss. Gentle hair care practices. A lot of people think that if you fight with your hair, they're going to grow well. No, that is wrong. If you oil your hair, do it very gently. Hair are living tissue. They, just like your nails, they also need blood supply, they need care. So use a good shampoo. Always try to use a conditioner. And apart from that, be gentle when you're brushing your hair. Be gentle with all the treatments that you do. Do not overdo ironing, do not overdo straightening, do not go against the nature of your hair. Stress management is also a key if you want to control your hair loss. Try to control your stress by going out, going for exercise, going out into the outdoor, live with nature. Try to control your emotions, your anger with yoga. Also try deep breathing exercises. This would help in your general well-being and that would in turn help your hair loss. Good scalp health. This is important because if your scalp is too oily, it is always going to lead to excessive hair fall. If your scalp is too dry, that would also lead to more hair loss. So maintain it according to your scalp, according to your skin. If it's oily, shampoo regularly. If it's dry, add a conditioner, add some sort of oil. Use massages, but very gently. Do not fight with your hair. Now, after discussing all the prevention strategies, there is definitely going to come a time if you are genetically susceptible, you are going to end up with hair loss, hair thinning. Even after trying all these prevention strategies, if you still are unable to control your hair loss, that's where you start some sort of medications. That's where I come into play. In treatment options, we have certain things that are available over the counter. For example, minoxidil, it's available worldwide over the counter. In men, I recommend 5%. In females, I recommend 2%. There are a lot of multivitamins which are available over the counter. For example, biotin, zinc, iron, folic acid, vitamin D. All these things are available over the counter, and you can purchase them, and you can do self-medications if you're too anxious to go to a doctor. But then, if these are not effective, that's where you must see a doctor. A doctor is going to prescribe certain medications that are not available over the counter. For example, finasteride. Finasteride is a drug that controls your hair fall because of the genetics that you're losing hair. We recommend this in males, in young males, and it is really effective. It has its own side effect profiles. We'll talk about that in some other video, which is based purely on finasteride. But it is one of our very good treatment options. We do not recommend this in females. Apart from this, if there is a disease in the scalp leading to alopecia areata, for example, that is going to need steroids. If there is a disease, for example, seborrheic dermatitis, that is also going to need medications, probably antifungals, probably a topical steroid, probably a combination of both. Other diseases like lichen planus or scarring sort of alopecia, that will also require treatment. Apart from these treatment options, now there are many advanced options to control your hair loss. Top of the list, PRP. It's very common. It's platelet-rich plasma drawn out of your own blood because it contains growth factors. PRP is the first step in regenerative medicine. It helps to control your hair loss. It helps to strengthen your hair. It helps to increase the thickness of your hair, but it requires multiple sessions, mostly 3 to 6 sessions, spaced 1 month apart. Apart from PRP, plasma-rich in growth factors, or PRGF, is also in practice. Then there are exosomes, which are preformed, and they are injected into the scalp, and that controls your hair loss, and it also promotes new hair growth. Regenera activa, that is another treatment modality where punch biopsies are taken from the scalp and they're processed in the machine and then injected back into your scalp. All these advanced treatments, they are based on the fact that body is going to regenerate itself if we give growth factors. All these things contain growth factors like platelet-derived growth factors and fibroblast growth factors, endothelial growth factors. All these things together, they help to control your hair loss. Now, if all these non-surgical treatments fail, that's where you end up with a plastic surgeon with good hair transplant skills. That's where hair transplant comes into play. In conclusion, hair loss, it's a daunting problem. It's difficult to understand, it's difficult to investigate, and it is very stressful, particularly if it starts early, like in your 20s. But you need to understand that it is treatable. There are treatment options available. From prevention to cure, you need to select a good doctor. You need to get the treatment in time. It's very easy to treat hair loss, but it is difficult to treat baldness. Always remember that. But even if you get bald, you have an option of hair transplant. So it is something which is treatable. The only thing you need to do is get up, search it out, and see a good doctor to get it treated. Thank you.